Thank you for listening to this update on the Child Health BC Hip Surveillance Program for Children with Cerebral Palsy and the impact of COVID-19 on the program. I'm Stacey Miller. In the next 10 minutes, I'm going to share with you some data related to our current enrollment, as well as the impact of suspending hip surveillance last March due to the COVID-19 pandemic. I'll also share with you some of our results from our 2020 therapist survey, particularly related to virtual care. So first, an update on the program. As of March 31st, 2021, we'd enrolled 1,134 children in the program. Having discharged over 300 children, we continue to follow over 800 children. When we started the program, we encouraged all children born in the year 2000 to present be enrolled in the program. We knew that it would be challenging to find the older group of children, and that has proven to be true. And you can see that here based on the distribution of children enrolled by birth year. We also anticipated that the program would be most impactful for children born from the year 2010 to present. And so for the remainder of the slides, all the data that I'll show you will be based on kids born in the year 2010 to 2019, recognizing that kids born in 2020 and 2021 are unlikely to have yet been enrolled in the program. So in those birth years 2010 to 2019, we've enrolled 705 kids in the program. We don't know the number of kids with cerebral palsy in the province, so we need to estimate this number using BC's population and a prevalence rate of cerebral palsy of 2.11 per 1,000 live births. We estimate we've enrolled about 71% of the children with cerebral palsy born during this time period. This graph shows those 705 children born from 2010 to 2019 by GMFCS level. Wanting to know if this is the distribution we should expect, we compared our numbers with a study that was published in 2004 from Ontario that reported GMFCS levels for 657 children, and that's shown here on the right. You can see that the distribution for children at GMFCS levels 4 and 5 for our data and theirs is quite similar, but we're quite different in the number of children at GMFCS levels 1 and 2. This is a busy slide, but what's shown here is data from a study that was published in 2011 that looked at the distribution of children in different CP registries throughout the world. And so you can see in the top row is all the different registries and the number of children by GMFCS. And there's a lot of variability in those numbers. But in the bottom row, what's shown is if you combine children at GMFCS levels 1 and 2 and kids at GMFCS levels 4 and 5, the distribution starts to look quite similar in all of those registries. And so what we've done is combined our kids that are followed here by GMFCS level 1 and 2 and 4 and 5, and then compared it based on that distribution shown in all of those registries, compared it to how many kids we'd expect to have at those different GMFCS levels. And what you can see here is that if we use that as a guide, we actually are doing pretty well in the number of kids we'd anticipate to find at GMFCS levels 4 and 5 and at 3, but are probably low in kids at GMFCS level 1 and 2. And that's probably not unexpected. We know those kids are at low risk for having a problem with their hip, are not followed quite as frequently, particularly once school aged, and so not surprising that our numbers would be low for those GMFCS levels. Now looking at the enrollment by region. So again, this is just for kids that are born between 2010 and 2019, and looking by health authority. And so you can see here, Vancouver Coastal having our lowest enrollment rate at 59% versus the North having the highest at being 107%. And again, that's looking at the number of kids that we expect to have CP just purely based on the population within the province, and with the assumption that the number of kids with CP is kind of evenly distributed across all of the health authorities. If we looked more closely by region, there's also differences within the health authorities. So you can see here, this is Fraser, and Fraser is broken up into Fraser East, Fraser North, and Fraser South. And our numbers are quite low in Fraser North at just 46% of expected. In the interior, ranging from 40% in the East Kootenays. We know that some of those kids are followed in Alberta, and that might affect our ability to enroll, and as high as 75% in the Thompson, Caribou, and Shuswap. In the north, quite a difference here, looking at the northeast at only 48% of the kids that we expect to find in that region having been enrolled versus much higher in the northern interior and the northwest. And so we have some work to do in that northeast part of our province in being able to identify children. Vancouver coastal, fairly consistent across all three regions of Vancouver, Richmond, and then the North Shore Coast Garibaldi region, all kind of hovering around that 60%. And then Vancouver Island, South Island doing very well at 100% of what we'd expect, and then Central Island 68%, and the North at 60% of what we'd expect. This program really started due to the high number of salvage hip procedures that were being done here at BC Children's Hospital. And the salvage hip procedure is when the femoral head's removed because it's too damaged to be put back into joint. And back in 2008, about 35% of surgeries being done were those salvage hip procedures. By the time we started the program in 2014, just with knowledge translation and education across the province, that number had been reduced to 15%. And when we last looked at our surgical data in 2018, less than 4% of procedures were salvage hip procedures. So even early in the lifespan of this program, there's been a significant impact on children with cerebral palsy. So now looking at our COVID-19 response. Back in March of 2020, to be consistent with the current health orders, we stopped recommending that imaging be completed. Anybody that was due for a hip X-ray was sent a letter saying that we didn't recommend imaging, but that they should contact us if they had any clinical concern, particularly related to pain. We restarted doing X-rays in June of 2020 and started with recommending X-rays for those at highest risk. So kids at GMFCS level 4 and 5, and those whom we knew already had a higher migration percentage. At that time, we also asked community therapists that were completing clinical exams to still send us as much information as they could and to just omit doing the hip abduction measurement if they were seeing children virtually. At the end of December of 2020, we reviewed children who were due for an X-ray during that time of suspension, so from March to June of 2020, and anybody that had done an incomplete X-ray that was ordered in the 6 months prior to March 15th, 2020. And so we reviewed 178 kids. 114 of those were due in that March to June period, and then 64 had incomplete imaging from the prior 6 months. Of those 178, a small percentage, just 13 kids, had imaging completed during that suspension period, and 2 of those were due to pain, and the other was were done as part of orthopedic appointments that were deemed urgent. So as of December 31st, 2020, when we did this review, 121 children, or 68% of those that we reviewed, had their imaging completed. They were an average of 142 days late. Of those, about a quarter, so 30 kids, had a migration percentage that had increased more than 7%, which is our kind of threshold for actually being a true change in migration. And of these 30, about half had a migration percentage that was over 30%. And 30% migration is our threshold for being seen by an orthopedic surgeon, and so would be considered clinically significant. Of those 30, most were already followed by an orthopedic surgeon. We also looked to see if anybody had a more significant change in migration percentage. And so there was 5 kids in 5 hips that had a migration percentage that changed more than 20%. And most often that was in kids that were at GMFCS level 4 and 5. And one of those kids did require re-referral to orthopedics. The child with the highest migration percentage at review was 70%, and it had increased from 59%, but he was already being followed closely and has since undergone reconstructive hip surgery. As of the end of December, there was still 44 kids that were overdue for imaging, and you can see there across GMFCS levels, and certainly for us, the most significant being those kids at GMFCS level 4 and 5 that we know are at risk. And you can see there, most of them had previous imaging, and some of them had high migration percentages already. 6 HIPs had migration percentage greater than 30% at the time of their last review, and so those would be of concern for us, and we certainly continue to try to get imaging for those children. When last reviewed at the end of March, 34 kids were still outstanding. As far as the impact of COVID-19 on enrollment in the program, you can see here this is the number of children that have been enrolled over the lifespan of the program by year. You can see here large numbers enrolled in 2016 and 2017 when the program first started, but then fairly consistently over 2018, 2019, 2020. And we reviewed the average number of enrollments per month in the 2 years prior to the pandemic, and that measured averaged about 13 enrollments per month. And from March to December of 2020, it was only really down about 1 enrollment per month, averaging 11.9. So we've managed to still be able to find most children despite the pandemic. Now looking at results of our 2020 therapist survey. We've completed therapy surveys in 2015, 2017, and most recently in 2020. Unfortunately, I don't have the time to share with you all of the results of our 2020 survey, but did want to share with you some that were related to the COVID-19 and the use of virtual care. Prior to the pandemic, most people reported that they were not using virtual visits as a way of providing face-to-face consultations. But since the pandemic, most people, 86% of respondents, reported that they were now using virtual health platforms. When it came to barriers for virtual care, the most often cited barriers were families were not familiar with the platforms and did not want to be seen virtually. There was also concerns related to families being unable to afford the technology and there being a lack of Wi-Fi or poor connection. Therapists also reported that completing a clinical or physical assessment, as well as engaging the child and family, was difficult over virtual care. When asked about their satisfaction with using virtual care, about 44% said they were satisfied or very satisfied. You can see here that not a lot were dissatisfied, and most people kind of sat in the middle somewhere. Thank you for listening to this update.